Hello everyone, this is Dr. Abdullah Mouhibi, resident in Obstetric Department at the University Hassan II, Casablanca, Faculty of Dentistry, Morocco. We have published an article entitled Effectiveness of the Laser on TMD Systematic Review in the International Journal of Science and Research with Professor Chafii and Professor Andoh. We declare that we have no conflict of interest. We will start our presentation with the introduction that temporo-mandibular disorder are the symptomatic expression of mandibulatory system pathology that may be muscular or articular origin. It includes the anatomical, histological, and functional abnormality of the system. Standard treatment using occlusal splint is considered to be onerous and expensive. The new era of the laser has allowed a great evolution of the dental practice, especially in occlusodontics. Thanks to low-level laser therapy, which is low-energy light appliance, allowing to increase the speed and the quality of the injured tissue and the healing process. This treatment is limited to a few sessions and a few minutes. Its mechanism of action is based on the increase of cellular energy ATP and the reduction of free radical, the oxidative stress. The use of laser is the typical output of power of the low laser therapy is between 10 to 500 milliwatt, several irradiation points as you see in the picture. For muscular pain in the blue point and articular pain for the red point. This work is a systematic review that aims to analyze the scientific literature during the period 2007 to 2017 for all articles dealing with the effectiveness of the laser in the disorder of mandibulatory system, and to answer the following issue: what is the place of the laser in the treatment of TMD? Is the laser an alternative to occlusal splint? Is the laser an indispensable tool in a clinical practice? Second, it was material and method. An exhaustive bibliographical search was carried out on the PubMed database with mesh words and according to the PICO method. Mesh words used laser therapy, low-level laser therapy, temporo-mandibular joint disorder, temporo-mandibular joint dysfunction syndrome, facial pain, occlusal splint, temporo-mandibular disorder. As inclusion criteria, it was article dealing with the effectiveness of laser in disorder of mandibulatory, the FCT randomized clinical trial, meta-analysis, systematic review. The period was from 2007 until 2017. As inclusion exclusion criteria, the animal study and the case report. The selection of articles meeting the inclusion criteria based on their title and abstract, then critical reading of the retained article full text by applying the appropriate reading grades to each type of study. True readers have checked the criteria and read the article to confirm eligibility. We followed the methodology of PICO by defining the P as TMD, the patient home consult for TMD, I as the laser, C as the occlusal splint, which is the gold standard treatment, and the O is efficiency regarding the pain and mandible motility. The analysis of parameters was as the triad DAPN, dyskinesia, pain, and noise. For result, we had 3 articles, 2 as a randomized clinical trial and 1 as a systematic review. In the first study, the authors evaluated the pain with the pain score tool for 3 samples of 10 patients. A different treatment was used in each group: occlusal splint, low-level therapy, and placebo. The results showed an improvement for the 2 treated groups, which means that the LLLT is effective as the occlusal splint. For the second study, the pain and the distribution of the occlusal surface were assessed using the pain score and T-scan tool for two samples of 9 patients, 5 from the experimental group and 4 from the placebo group. The results showed no significant improvement between the LLLT and the placebo-treated group. The third study was a systematic review. She evaluated several publications and concluded that there was no consensus regarding the laser efficiency and that there is a diversity of protocol, energy level, density, appliance time, frequency, session number, and the reassessment. Also, the follow-up period. Finally, in our discussion, the publications on the use of LLLT for TMD treatment are limited. However, the low-level laser therapy has shown equal efficiency to that of conventional treatment by occlusal splint for the treatment of muscular pathology and joint pain. Low-level therapy appears to play an important role in the management of pain with TMD. Patient with TMD, and the use of the laser is promising and has several advantages. The study selected, despite their limitation as the small sample studies and the non-standardization of their protocol, report the lack of evidence and consensus regarding the dose administration, the duration of appliance, and the long-term effect of this treatment. The lack of standardization leads to different results and makes comparison between studies difficult. More research should be directed toward the standardization of all these factors. We will conclude that the treatment of the TMD is complex because of their multifactorial etiology. Low-level laser therapy has been accepted as a good adjunctive therapy in pain control, stimulation of healing, and improvement of functional condition. Laser treatment remains a symptomatic treatment. Despite of all the commercial advice, the new area of laser must be taken with care. Further studies are essential to reach consensus and the best appliance protocol, greater clinical experience, and even the evidence-based results.